doctor could support that, then you could go forth with that. You could use your doctor or your therapist. Some people ask for both. I use one, which was just my doctor. The next thing about this is when it comes in. This is the part I want you to understand. When your gender marker is granted and your name change is granted, please start changing your things right then in that very moment. It is very adamant that you change that because as you go through that, if you're working, your taxes won't show up on that. You definitely will have to go in personally to the IRS and show that to show who you are, and with along with your bank statements, your birth certificate. If you're trying to get your birth certificate sealed, please ask the lawyer what does that take. For some crimes on your record or some backgrounds, they will not seal your record. This is to protect you so people don't misgender you or try to use that against you in any form or fashion. So what else is there? Brian, I'm trying to remember what else it is. It's a really simple process. It used to be difficult. Um, they now have it. This is the part I'm gonna get personal for a moment. When I did my name change here in Houston, I literally had to stand in front of a room full of people and explain why I wanted my name changed. That is no longer something that occurs here in Houston. And if you go through the agencies that I named, you don't have to go to court. That is not a good feeling because anybody could be transphobic or have any biases and choose to attack after that. And I think that that was one of the things I spoke about to judges, that that's not safe. So a lot of people have paved the way to make this an easier process and for the safety of our trans siblings. But we all have to understand that this is for you. Do not let someone take this from you. So I advise you to reach out to the Houston Volunteer Lawyers that Make Justice Happen.org or Trans Legal Aid Clinic on Facebook. They definitely are getting ready to have a class, a open thing on Thursday, if I'm not mistaken. That's it on my end. I know that was quick. Anybody have any questions? Let's talk about it. Come on, Crystal. Come on with some questions.
I mean, I'm open to discussion and I don't want anybody to feel shy about asking
Yeah.
questions because this is really an opportunity for us. Like when we set this up, we say, you know, we take care of each other. We already know how it is to be in community and need a service and like don't know where to start or don't know anybody who can help. And so this is really an opportunity to ask the questions that you would ask your friend who might work for an organization or might be in community. Um,
One thing that was important about this whole thing, especially with the process with Houston Volunteer Lawyers, when they came down into we were at the M Society, they had never even thought about coming into the Black community, and that we had not got those resources. No one knew about it. After they dealt and did that clinic with us with SOS, they now had it where you could type in trans on their search bar and it brings up their application. So these are steps that were not given for us until we start fighting and advocating for that for ourselves. And I think that we definitely need to honor that because under the current administration, it could have been taken away. So I advise anybody to go ahead and get what you need to get when you can. Reach out to me, Atlantis Narcissist on Facebook or Save Our Sisters United. I am free to open questions and walking people through it hand to hand.
the doctor's letter need to follow WPATH guidelines, or can it be any doctor's letter? I don't know what WPATH is. I don't know if you want to explain that.
I don't really like WPATH because it's a 40-year-old plan plus that thinks that one size fit all for trans people, and that's not fair because not all trans people have the same bodies and we don't have the same care, but it does have to abide by these rules. It definitely does. And as well as with your therapist, it can't just be any doctor, but if it's been a doctor that's treating you for your HRT, which is your hormone replacement therapy, definitely yes. If it's a therapist that have been dealing with you through your transition, definitely yes. So you have to have these things, but it just can't be a doctor from your ear doctor and say, hey, yeah, this is a trans person. It has to follow the WPATH.
Thank you. So I know that the Mahogany Project is also doing notary services. Can you explain like that process? Explain to someone who doesn't understand any
So
of this, like how, like what is the flow of everything?
So basically what happens is that you set an appointment, you fill out the application. As I said, if you go to Houston Volunteer Lawyers, from there, they set a date for you to meet with them, which is the clinic. And then they assess everything. They ask you to bring in these forms, your fingerprint card, your birth certificate, your ID, your doctor's statement, and any other form they may need, like a background check if you have something on your record. From there, they go in. When you go in, you do the assessment, and right there where you hear the notarize and come in. Usually they have their own notary public on hand, but sometimes there are forms that are needed prior to that you want to already have done that you could utilize notary services between Save Our Sisters United and the Mahogany Project. From there, once they get your paper, they take everything, your original documents, and they e-file it. And once they e-file it, they send you back everything and say that if you've been approved or if it's been granted, they walk you through the process and let you know. Eventually, they email you back your original declaration, and then they mail you back your original items, like your birth certificate and this and that, whatever. And do realize that when you go to change your birth certificate, you also have to send in your original thing. Like even with your passport, all these things. So don't get alarmed when they ask for your original birth certificate and stuff, because they need that and they send it back. So it's not like they're going to keep it.
Mhm.
And wait, and on the birth certificate, there are a short form and a long form. Don't be alarmed when you see your old name at the bottom and the amendment at the top. So understand that. That's if it's not sealed. If it's not sealed, it will be the short form.
Thank you for that. Um, we're going to go ahead and transition to, and thank you. And so Atlantis is putting her information in the chat. And we also have a resource that we can put together. I know Bernice and I were talking about how this could look, but there is a resource list that the Mahogany Project developed that is trans focused. And so we'll figure out how to get that to you, but Saving Our Sisters United will be included in that resource list. And Bernice is also saying you can book an appointment for notary services on the Mahogany Project's Facebook page, and it's a free service.
Mhm.
Awesome. Wonderful.
Same here. Reach out if you need a notary.
Wonderful. Thank y'all. Okay. So I'm going to welcome Catherine.
My name is Catherine Fergus. I'm a case manager. I work for AIDS Healthcare Foundation. We have two different clinics, and one of our clinics, one of our main focus is serving our trans population. So since I've been doing this about 5 years, one of the things that brought me into this and really made me passionate was when I was working with people, unfortunately, the lack of resources that were available. So I've had a lot of conversations that have to go where it's, I don't know the answer to that, but we're about to learn together and navigating. So what I've learned so far along the way, I will help not only just, so I primarily work with people living with HIV. I also work with people that do not. So in our clinic here, although we are under AIDS Healthcare Foundation, as Dr. Hunter Hamill, private practice, we also serve non-HIV trans folks. So one of the things basically is, so what to expect. And I do cover a little bit further about being able to assess your resources and what that looks like versus insured or non-insured. But one of the main things is, and I'll talk about how to choosing your provider, but basically people come through on different parts of their personal journey, and we can't assume that in the clinic. You should never have anybody tell you what your part of your journey should be or is, but that's you communicating that. So whether someone's coming in and they just want to find community, whether they're looking to have their name changed, gender marker changed, gender affirming care, whether that's hormone therapy or gender affirming surgery. Basically, coming in, when you're choosing a provider, some of the things to remember is that any licensed medical doctor or nurse practitioner can give a prescription for hormone therapy. That doesn't mean that they're necessarily qualified to do so or should be doing that. Meaning there's some important questions to ask, whether you are going to your primary care provider, walking into a federally qualified healthcare center, going into a medical spa under the direction of a medical director, any of those things. You're going to be asking questions like, what percentage of the population do you serve are trans folks? Or how many do you have? How long have you been doing this? Whether you're insured or not, there's things that people worry about, lab monitoring. Although it's not preferred, it's not necessarily required. And a lot of that is the relationship that you have on with your provider and your self-report. There's not a standard for hormone therapy dosage. When I ask my provider here what makes him stand out or what's the difference, he said that because there's not guidance, there's a lot of providers that typically underdose. And he really feels like the treatment plan that you put together should be collaborative. So talking about your care plan is essential. Don't just be told what to do. Hormone therapy does not produce results overnight. Testosterone takes a lot longer to show up effects of that than estrogen, which may be a month to 3 months, where testosterone's a little longer. Another good thing to, when you're choosing your provider, is to ask about what other services they provide, whether they're direct services or referral to other services. So for instance here, although we don't provide services in-house, we make sure to tell people about what referrals we do make. We have a lawyer here that works directly with us that we can refer our patients to, that is free of charge. And there's also things like mental health referrals. That's another thing, although it might be recommended that you, at some point in your journey, have sought counseling. It's not a deal breaker, at least here with us, for hormone therapy. There's also things that our clinic will provide, things, it's called a carry letter, which is basically if the name that you go by or how you present does not match the photo on your ID, it's a letter stating that you are engaged in gender affirming care. That's something where, yeah, you get pulled over and somebody says, this doesn't look like you on your license, then here's a letter that you can show if you run into things like that. And providers here, at least most places, will also do things like the letters that you might need for clearance for, say, a gender affirming surgery. What to expect during your first appointment. There are things that you'll be asked. The main things with at least hormone therapy is whether you smoke, you've had a stroke before, you have high blood pressure. Our doctor said that as far as smoking goes, he'll say, what is your priority, cigarettes or hormones? And if your priority is cigarettes, then, maybe you're not in it to win it at this point, but it's still not a deal breaker. Another question a provider might ask you is, how long have you felt this way? So if you were to say, a couple months versus, my whole life, those are something. And again, those things aren't deal breakers. It just leads to a little more in-depth assessment, and that's both physical and mental. Anyway, I talked about the medical and mental, the physical and mental release letters when you're doing gender affirming surgery that you can get from your provider. We also have a woman we refer to, Sonia Edwards. She has free Saturday group sessions, and she also does private sessions with certain insurances or pay out of pocket. As we traverse a lot of this care, whether it's resources or not, There are very few experts in Houston that do this. Although they might be an expert, there's still going to be a question that they're not sure of. There's still some gray areas sometimes, like what does menopause look like is with hormone therapy for female to male transition, and there's just not a huge amount of data on it yet. You should always be able to have transparency with your provider. So whether it's your case manager or your provider, expect that you might encounter the response, "I'm not sure, but we'll find out together." That doesn't mean that they don't know what they're doing. It means they're being honest about what they're gonna find out for you if they don't know. Of course, always ask if case management's available. If they have that service, it's a great, your doctor may give you your 20-minute visit and say, "I'm prepared to refer you to a surgeon," but you want to talk to someone more about what that looks like. Usually case management is there and can help you with some of those things. So going into insured versus non-insured, there are federally qualified healthcare clinics like FQHCs, like Legacy, St. Hope. Not all that provide gender affirming services. There's also private practice where you can have insurance or pay out of pocket. Some people choose, even though they have insurance, they choose to do their hormone therapy, say, out of pocket because they're not ready for a diagnosis to go on their main medical record, say. Sometimes these are sliding scale fees based on income, and sometimes there will be a set fee. For instance, $100, $150 for your first visit, $85 for each visit after that. There's also Ryan White funded clinics. So it's important to know that if you are HIV positive and you are enrolled in Ryan White services, that covers primary care along with HIV management and hormone therapy. So medications that are not covered by the state will be covered, non-HIV medications will be covered on the Ryan White formulary. And I've also included a link to the Blue Book here, which can give you some more information about clinics for that do Ryan White services. So moving on to that. So as far as health insurance options go, right now is open enrollment for marketplace insurance, which you can, it's important to know that there's some insurance plans that are better than others as far as gender affirming care and services. For instance, United Healthcare, I know I have personal experience with my clients using United and Blue Cross Blue Shield, but for instance, Blue Cross Blue Shield requires you to see a specialty care like a gynecologist or something like that for hormone treatment that you have to have a referral for from your PCP, whereas United, you do not. So I don't know who is an expert in insurance, even if you have it. I'm certainly not. I work with a person who is a navigator who can talk you through specific what your needs are and what plans. And I listed her information here. Her name is Happy Dyer, I'm sorry. And those numbers are listed below. So say that the insurance company that you have through your employer is not a good one to cover these things. You want to decline your employer insurance and get marketplace insurance. You can do that on your own. Also, a good thing to know, if you are HIV positive and enrolled in Ryan White services, you can get your own marketplace insurance and Ryan White will pay your premiums, co-pays, and deductibles. It's a very important thing to know that a lot of people don't utilize or know they can starting out. Also, these are, I won't go into this real in depth. If you are using a navigator or if you're just going straight to, United's enrollment, there's some things that you want to know about sex-specific preventative services, which I listed here. Also, there are some, oops, let me see. There are plans with transgender exclusions for those preventative care things. So you're also going to want to know, you're just going to want to know, be able to look at your plan and know what you're looking for. And that's usually done by Health Navigator. Let's see, these are examples of sort of some of the coding for this. So a lot of the care that goes through insurance has to have a diagnosis that's attached to approving certain services. Gender dysphoria is one that is coded now. Thankfully, we're out of the DSM-5 as this being considered a mental health diagnosis versus a physical diagnosis. And these are just some examples of how those surgeries and affirming care would be coded through your insurance company. And then I have up here my contact information, as well as the clinic that I work with, Dr. Campbell. He's seeing patients today, but if there's any direct questions that you want to ask a provider specifically, you can post them in the chats, or even email me directly, and I can have those answers by the end of our session, or as I get them, or again, directly through email. So that is a huge amount of information, and I know if there's any questions I can answer. Normally, I'm a lot more passionate and can go a long time about this in trying to keep myself reined in and to an outline. I know that I hope it didn't seem as reading as much as I wanted to talk about some of these things and challenges. But if y'all have any questions, please ask me. This was sort of broad because I know based on the presenters we have after this, there's going to be some things that are a little more in depth. I would say my take home more so in speaking to what part of your journey that you're in. And when you come into a provider, you're looking for one, I think it's real important to acknowledge sometimes, we're asking, what brings you into today, or what can I do for you? But the real question should be from a provider is, what can I help you with? And that is you navigating what it is that you need help with, because some things you don't need help with. Sometimes you've been in this journey. I have in the last 12 months, 2 clients, one who has been within this process for a hot minute and got her gender affirming bottom surgery at 29. I have another patient, another client who has been on hormone therapy for years, has presented for the last 20 years, female, and now at 62 years old, has the insurance that she needed available to finally do her gender affirming surgery. And so what she needed my help with, there were things that came up that had nothing to do about a carry letter or legal, say she knew some of that stuff, but she wanted to have a conversation around disclosure. Like, I've already made this decision and it's something that I want to do, but where do I need to tell people that I care about that I'm about to do this phase of my journey? Or, who medically needs to know about that? Or when I go into emergency room because I need stitches, do I really need to say anything about hormone therapy I'm in, or what my gender marker is, or anything like that? So sometimes it's just, isolation is a big thing. You have folks that they're the only trans person they know in their life. And so asking some of these questions, again, if they're not questions you can put forth to your community and you have that support, sometimes it's a matter of asking questions with a person you've built rapport with. And my answer might be, we're about to learn together, I'm not sure. things like that. So yeah, that's about all I have.
Hey, hi, my name is Tejas. My pronouns are he, they. Thank you y'all so much for everything you've done so far. I'm really learning a lot. I had a question re providers, because you said that pretty much anyone could prescribe HRT. What are some like guidelines or questions you should be specifically asking your providers to see if they have like the appropriate knowledge?
So like I said, one of the important ones is do you serve other trans folks? You know, what percentage of the clients you serve are trans? How long have you been doing this? You can ask things, what's your philosophy on dosage, or how do you make those decisions? So I mentioned monitoring labs is not completely necessary. You're going to have some medical history taken where it's important. They want to know what other medications you're on, if you've have history of high blood pressure, stroke, or if you're a smoker. Let's see what else. There's some important things to know. You should be having a PAP and like breast exam every year. And a lot of people overlook that. So if you're, say, going to a med spa and you went there to get Botox or any like facial feminization or anything like that, and they said, hey, did you know I do hormone therapy as well? Although they can do that for you and they don't need labs to monitor it, especially if you're doing out of pocket, it would be good to also be seeing a gynecologist for some of those annual things. Or I'm trying to think specifically speaking to that. Yeah, like our provider said that the care is really collaborative. So he's going on self-report of how are you feeling? What are the results that you're getting? So if you are, and another thing is that you should feel in a safe space. Like your provider should not be talking in code, should not be uncomfortable by this conversation, and should really be asking for your input through the whole process into how can I help you, to how do you feel this is going, instead of saying, well, this is where you should be or what you should be doing. So those things are important, that you feel heard, you feel safe in a space. Although a lot of these people can prescribe these things, like I said, they shouldn't be, and they don't have to. You could call a gynecologist in your network and say, I want an annual exam, or I'd like a consultation for hormone therapy. Still, you're not saying anything. They could say, sure, we'll make an appointment. I think it's good to say in that appointment that you are transgender or where you are on your process, because if they don't want to provide that care or they are not comfortable, let them tell you on that phone call. And another thing that, if there are platforms that you use, whether you're a part of a group or whether it's just on your Facebook page and you're comfortable sharing that, when you do encounter, whether it's a primary care physician or otherwise, that you feel creates a safe space, share that. If you feel that there was one that didn't, share that. Save people, the trauma of being in that space if they shouldn't be. So those are some of those things I think are important.
Yeah, okay. To that point, do you know if there are running lists somewhere of affirming providers or ones that patients have had really good experiences with, or is that something that still needs to be built?
So that's kind of where I run into trouble a lot of times. When you just get on to Google something like WebMD, that can be really frightening. In my experience, when it comes to trans resources, there are a lot of like national sort of resources in Houston. Unless they're hiding, I haven't found a lot. I can tell you off the top of my head, one friendly PCP is Dr. Jafari with UT Physicians. One for gender affirming surgery that both my clients in the last few months have used is Dr. Freet, Freet, and he travels around to different hospitals based on your, coverage or where you need to be at that time. Sonia Edwards is the mental health provider that I recommend too. And I will, I know that there is a list I received last week that is being compiled. I will certainly go through and add or drop these in the comments. I can scrounge some up, but I know that, also you can say by organization. Legacy is absolutely provides those services competently. AIDS Healthcare Foundation, where I work, Dr. Hamill's been doing this over 30 years, has over 500 trans patients right now. And he can also give me some that he would refer to as well. So I can provide a little more specific list for you.
Okay, thank you.
Mhm.
Thank you. Thank you, Catherine. I know we are pretty much on schedule. I do want to get a break in for people because it can get a little bit rough just sitting here all day. So I'm going to play a little music. Y'all go get some water, walk around, do what you have to do. And then Catherine, I love that idea of like compiling the list and adding to the running list that has been created so we can start circulating that information.
There's a list that had been put together. It's from the Texas Transgender Alliance Resource Guide that you could look, and it has a bunch of doctors that have been vetted and everything and services across the board for trans and non-gender conforming. You can find it on, I put the thing in there. If you Google it, it'll come up with the guide.
Then look for the groups like Serenity Sisterhood, things like that, because there's no more expert on ourselves than ourselves. And sometimes in those groups, you have people that can give you those referrals from lived experience in all different parts of that journey. Those are awesome resources. And at the same time, gets you connected in with a support system. So.
All right, thanks y'all.
Wonderful. So I'm going to drop the link in the chat. And this is through the Trans Ally Collective, but the resource that Atlantis just talked about is listed right there on the website. So you can click on it and you can see all of the providers that have been collected. And this was collected by trans folks. So you'll have it right there. Thank you.
Hello, everyone. Before I get into this, I want to first give a shout out to Crystal for inviting me to speak on behalf of Legacy, and of course, Vernus and everyone over there at the Mahogany Project. I have been around from the very beginning, so it's great to see the continued work and efforts that's being led to bring resources and information to trans and gender non-conforming communities, specifically of color. So thank you so much. My name is Amir Gibson. I'm the lead community engagement coordinator for Legacy Community Health. For those of you who are not familiar with Legacy, we are a federally qualified healthcare center, and we exist to bring well-care services to people regardless of their ability to pay. And so if an individual is underinsured or non-insured, we have programs to be able to offset or cut costs. Specifically, we offer a lot of different services from primary care, vision, dental, behavioral health, and social services, but as it relates to our gender care services for our trans and gender diverse populations, we can do wellness exams, hormone therapy, pre-op, post-op, follow-up care for gender-affirming surgeries, linkage to sexual health and prevention services, and so much more. We're committed to connecting communities regardless of their background into care, and we are really trying hard to expand our services in a meaningful way. For patients who have insurance, typically if you want to come in and get a service, it will be whatever your traditional copay is. And for individuals who don't have insurance, I've given you the what it is that we do. Typically what will happen for a person who does not have the financial means to pay, we would schedule them with a my apologies. We would schedule them with an eligibility specialist, and that person will walk them through programs and grants that will be able to help offset the cost. Let's see. After this event is over with, I sent over some information to Crystal in regards to a full comprehensive list of what it is that we provide. That's the flyer right there. It goes into extreme detail in a manner in which I probably won't be able to do it justice. I also provided her with some champions, two or three of my colleagues who are more than qualified to walk with anyone, specifically trans people, to navigate our care system. Look, I am a community member first before I am a public health professional, and I understand the barriers that are put in place for people who are marginalized. And when you're double and triple marginalized, it can be a frightening experience for you to be able to walk into a healthcare center and not know what your experience is going to be. I'm going to let you know that we are definitely working hard to be able to ensure that this is a safe space for individuals to be able to come in and get the care that they need, because at the end of the day, people are what and who matters. Let's see. I think that that's just a high level overview of what it is that we do. The rest can be a conversation. If you have any questions for me, I would definitely love to be able to assist. If I don't have the answer to them, I would love to respectfully defer them to individuals who could assist far greater than I can. And I know I have 15 minutes. I talked to Crystal earlier and told her that I don't think that it would take me that long, because largely we are a healthcare center that is pretty much known here in the Houston area. I think that this may be a reintroduction to some of you, and some of y'all are like family. I've known y'all for a minute. So if y'all have any questions for me, let me know. On average, how person does it take for a person to get into care? Good question, Vernis. It really depends. It takes roughly between, so I was looking through the schedule. It depends on the provider. We can get people in as quickly as a week from now. And then sometimes, depending on the provider's availability, it can be 2 to 3 weeks. However, I can give you all my contact information, as well as the information about another individual who is responsible for scheduling. And we can figure out a way to be able to get someone in. Now, if a person is looking for behavioral health services, that is a different beast on its own. Some of those appointments are like far out all the way into January. But again, we have ways that we can kind of navigate around that system if we know of an individual who is really in need or wants to get in care quicker than what time allows for us to do. And I want to piggyback, if I can, on something that Catherine said. Essentially, relationships with your provider should be collaborative, and you should definitely feel comfortable enough to be able to have conversations about a wide variety of issues. If you do not feel comfortable and you do not feel safe, you do not have to, you can forego those. That experience, and I would definitely encourage you to be able to kind of spread that word out, because if people are not advocating, and it can be hard to advocate for yourself, but if you are not kind of bringing people people to the pain and saying that the care is not okay, then it could be a little bit more difficult and challenging for the next individual. So I do encourage everyone to, if you can, if you have the ability to advocate for yourself, because times are changing and everyone deserves an equal and equitable opportunity to be able to receive healthcare services. Can you review the providers online? Are you asking, can you submit a review about providers, or can you view the providers who we have online?
Can you review like press reviews or see the different providers that you guys have available online?
I do not believe that you can at the moment, but I do know that we're continuously updating our website, especially considering everything that's going on with COVID-19. So I don't believe that you can right now, but I will look into that and make sure that I'm not giving you inaccurate information.
And you know, you mentioning COVID-19 made me think about a question, because I know that when COVID hit, there were a lot of changes that happened in the way people had to shift business. And
Sure.
so can you talk about how COVID has impacted Legacy in the way y'all are providing services right now, if at all?
Sure. So COVID-19 came and shook up the entire world. I think in good and bad ways, in the good ways, in the great ways, I think that it caught us up to speed. I had been advocating for a way to be able to meet people where they are. And oftentimes in community, we talk about the need to be able to meet people where they are. Well, COVID-19 allowed us the opportunity to be able to expand our services digitally. And so Legacy, like many other clinical systems or healthcare systems, we offer both video and in-person appointment, which is an extreme barrier breaker, because oftentimes people have challenges with transportation or the ability to be able to, walk into a clinic for whatever reason. Now we have the opportunity to schedule those appointments via Zoom, and you can have your appointment from wherever it is that you are. You don't necessarily have to come into the clinic. We even have a way now, it's slowly rolling out, so it may not be, depending on the service line that you're coming into, it may not be accessible now, but we are rolling out the ability for people to be able to submit their intake forms prior to them coming in digitally as well. Good question, thank you. For COVID-19, as it relates to for people who are looking for in-person appointments, we do require mask upon entry. If an individual is exhibiting symptoms, we will still see them. They would just go through a different process. And that's just to be able to ensure that we are protecting both the patient who is coming in and then the individuals who are in clinic as well.
Thank you, Amir. And I just, want to quickly kind of reiterate some of the things that you said, just to make sure that it's really clear, especially for those revisiting the recording. So at Legacy, and also tying it back to the Trans Alliance resource list. So Legacy is one of the providers on that list. That's the link we shared a little bit earlier. There's another provider that also at another clinic that provides surgeries. So top surgeries is what they specialize in, anything from the waist up. And I was reaching out to get folks involved, get community partners involved in this resource fair. They did mention that oftentimes they reach out to Legacy for a provider for their gender affirming care. And so in that care, you all provide hormone therapy.
Correct.
What else do you provide, just to kind of go down the list?
We do wellness exams, post-op exams, follow-up care for people who have gender affirming surgeries, puberty blockers, STD an STI treatment, and preventative options. So if an individual, we really try to offer a status neutral approach to all of our services. So if an individual is coming in and they're either living with HIV or not living with HIV, we have tracks for them. I know that we like to be able to incorporate the gender care services with primary care services. And so there's a rapid linkage piece that we do to be able to ensure that individuals are connected, and then they not only are connected, but they stay in care. We provide patients with a patient educator who is going to navigate them through our system as well. And we do behavioral health services and linkage to other, we do external referrals as well. It's good to know that people lean on Legacy for the services that we provide. I know for sure, specifically as it relates to the gender care and wellness services in the clinics, that they are really passionate about not only the work that they're doing, but making sure that people feel comfortable whenever they come into the space. And so they are definitely working to be able to make sure that the practices and the policies are in alignment with what the vision is for connecting communities to care.
Awesome. Thank you so much. So now we're going to transition to Jeffrey Campbell, who is the Chief Program Officer at AIDS Foundation Houston. And Jeffrey's going to share the services that AIDS Foundation in Houston provides, which includes gender affirming care. So thank you for being here, Jeffrey. And you have the floor.
Thank you so much, Crystal. Thanks to Fergus and the Mahogany Project for hosting this event today. It is a very exciting event, and it is an exciting time for our trans community, and also it is a troubling time for our trans community as individuals in that community, our trans siblings, continue to experience in the prevention and in the medical services world, continue to experience stigma and mistreatment, as well as just being unsafe in the world. So I'm happy to be a part of an organization that really takes seriously the work that we are building on when it comes to serving our trans community. I do want to say this, that we are building gender affirming care services that will be built out of our PrEP care clinic. Many of you may know that about 3 years ago, AFH became the first non-clinical Houston area community business organization or community-based organization to start a PrEP clinic. We did that start with Dr. Gordon Crowfoot and Maggie or Margaret White, who is his nurse practitioner. And so part of the work that we are we were doing is we were coupling our PrEP services to persons who are transgender with gender affirming care, with hormone treatment. And so Maggie was very excited about offering that service, and she quickly built up a good caseload of trans individuals who were both on PrEP and receiving gender affirming care. I will add that FLOSS, which is one of our leading organizations in prevention services here in Houston, with Elia Chino, who is a trans female, as their CEO, we partner with them and with our PrEP clinic. So we have a nice number of folks from FLOSS who were receiving gender affirming care through our partnership with Dr. Crowfoot. What AFH is doing now, and we actually started this process last year, we have begun to see patients for PrEP care at our West Park location. And so right now, and I'm actually talking in the place of our new director of clinic services, who is Kendrick Clack. And Kendrick couldn't be here today because he's actually seeing a patient right now through Helo or using a telemedicine app that we utilize to provide services. And So what we are doing now internally is we are writing protocols and procedures to get us ready to internally begin to launch a gender affirming care for the PrEP care patients that we have, that we see at our West Park location. One of the things that we have really realized and dug into as Kendrick has come aboard in this last 2 months is that we don't want to just throw together a program for our trans community. Gender affirming care is too important. Our trans community is too important. So we really want to understand and know what we're doing forward. One of the reasons that Kendrick came out as one of the top candidates for the Director of Clinical Services is because he has prior experience in providing gender affirming care at the Howard Brown Clinic in Chicago, Illinois. So that was one of the reasons that he stuck out to me as we were interviewing individuals for the position. So as we look at this, we look forward to, just as we built just a strong PrEP clinic, and as we're building and adding in other mechanisms in PEP, that I think is also important for our trans community. We're also launching a rapid start treatment program for those persons who are newly diagnosed and are treatment naive, and for those persons who are have been previously diagnosed but have been out of care for 6 months or have never accessed care. We will link them to medical care that day and get them on treatment that day. And that's possible because of our partnership with Avita Pharmacy that is located right in our suite with us. So I say all of that to circle back to gender affirming care, to our transgender community. We are really building I think what is another excellent provider resource for our trans community when it comes to access to PrEP, access to NPEP, access to Rapid Start, and programs called Start Now, and also now access to gender affirming care. So we're looking forward to continuing to increase our menu of options for our transgender community. And we're not, again, I want to emphasize, we're not just rolling this out and saying, here it is. Our staff have been and will continue to go through cultural humility trainings as it relates to providing effective and efficient and culturally appropriate services to our trans community. And that's both trans male and trans female. Even the work that we're doing in telehealth with our partner, Mr. and Sister, is trans appropriate. And that's a telehealth option that we're in partnership with. It's mistr.com or sistr.com. Or heymister.com or heysister.com. So individuals can access those services online. They will never have to come into a clinic unless there is an STD diagnosis, and then they come to us to get treatment for that STD. Or if by chance they seroconvert and become a person living with HIV during either their assessment, we find that out, or as they're on PrEP care. So we are excited about this opportunity, a greater opportunity that we have to serve the trans community. So I'm gonna stop right there. I don't know, there may be questions or comments. I know there are some other AFH folks. I don't know if it's anybody from the clinic on the call, but you may have questions or comments, and I hope to be able to answer them.
Thank you, Jeffrey. So I am looking in the chat, and I know we have some new folks coming into the space. And so what I think will happen as a result of this resource fair is that we will continue to collect resources and compile them and update a list to send out, especially to folks who have been here in this resource fair. I have slides from the previous presenters, and and guides that they've created to share with everyone. I want to open it up to see if there are questions for Jeffrey about the services that AIDS Foundation Houston provides.
I do want to share this, Crystal, and this might generate questions. So the services that we provide around PrEP and MPEP are free. Labs are free. We participate with Gilead's patient assistance program. So the medication is free. So for persons who do not have insurance, the services are free. We're working with Avita now to when it comes to the gender affirming care for persons who do not have insurance, to be able to extend our 340B pricing for the gender affirming care medications and drugs to individuals who want that care. So those medications will be at a highly reduced rate. So we're doing all that we can to serve individuals who are uninsured and need these services, because we are clear, we know what all of you probably know, that Texas has the most uninsured individuals across the nation. So again, I welcome you to questions. If you want information about AFH, you can go to AF Houston, that's A, Apple, F, Frank, Houston.org. There you'll see and be able to read up on our providers and practitioners. Dr. Taria Richmond is our Chief Medical Officer. Kendrick Clack is our Director of Clinical Services. And we have another nurse practitioner, Ralston Lockett. So it's a very exciting time for us at AFH. And we really are here to serve you. So this question is from Tejas Kumar. I love the dual PrEP access and gender affirming care model. Could you talk about how that developed and if others are catching on? So for AFH, it developed when trans persons presented and said, I want PrEP and I want gender affirming care. That's how it developed. And so we began to do the work to determine, how do we do this? How do we offer it? How do we equip ourselves to do it? How can we make it cost effective for the patient? And we've been working on this model now for about 3 years.
Yeah, so I have a question, and this is for all of our presenters. Is the paperwork and the process at your organization inclusive of non-binary and gender non-conforming folk? Because often we see people, when they speak of the trans spectrum, they only speak about folk who are living and existing in the binary, which still includes trans men and trans women. So is the paperwork inclusive of gender non-conforming folk, non-binary folk, asexual folk, intersexual folk? Is that paperwork inclusive? Is that enrollment process inclusive?
So I see where Amir has answered. So Vernon, I'll say I do what I do best. I'll be honest. I don't know, but I'll know by the time I get off this call and check in with the folks in the clinic. What I do know is that, because you've said it, that if it's not, by the time we're ready to roll this out in the early 2021, it will be. So thank you for attention to that matter.
Yeah, and I'll just go ahead and expound on my answer. That was an excellent question. I can say I've been with Legacy for 4 years. Whenever I first got here, we were not as inclusive as we would like to be. But this year specifically, we did a complete overhaul on our intake forms to be able to ensure that people were accounted for in the manner in which they should be. However, with that being said, just like with a lot of things in the healthcare system, there's a lot of room to grow. And so we're really, as the community changes and as people state that they are here and that they want to be accounted for and reflected in everything from the entry pathway point all the way to the receiving of the care, we are definitely doing what it is that we can to be able to assist. So And if it's not as inclusive as it needs to be, do speak up whenever you can.
Yeah.
I have one last question. For undocumented trans people, do you guys' organization report those individuals if they seek services through your organization?
No, absolutely not.
Same for us. We don't, and that is a major concern, especially considering the climate that we're in. But nothing that we do is report. Your business is your business. We only use your information to be able to assess your care. We don't do anything else with it.
Exactly. Great question.
I'm sorry, Jeffrey.
No, I was saying that's a great question, and no, we absolutely do not. And I will add that after Harvey, AIDS Foundation in partnership with FLOSS became a huge point for food delivery to individuals in our area, which is highly populated with Hispanic, Latino, and Mexican individuals. And that was their concern. So in the partnership with FLOSS, we were able to partner together to assure members of the communities that they all just come get your services, come get your food, come get whatever it is you need. And that is who we are. We are a human service provider. And we are not going to report you. So we continue that type of relationship even today.
Awesome. That's great to know. Thank y'all so much for your service and for being here today.
So now we're going to go to Charleston, who's going to share a little bit about housing. Charleston, did you want me to pull up any slides for you?
No, ma'am. If I have the capability to share the screen, I will do that.
Okay, good. I'm going to stop my sharing, and then do you see a green share button?
Yes, I know. I got it.
Okay, good.
Thank you. All right, so good afternoon, everyone. And again, thank you to Ms. Crystal Townsend and the coordinators for this event for inviting me. So I'm going to start by speaking about the Housing and Supportive Services Department here at AIDS Foundation Houston. It consists of 6 demographic-specific housing programs, and I will share the screen. So on the screen, you should see what would be a brief synopsis of the 5 of the 6 housing programs that we have here at AIDS Foundation Houston, and then we will go into specifics about all 6 of them on a different sheet. So I will start with Project Text Message, which is a program designed for young adults between the ages of 18 to 24. It provides housing, life skills, and guidance to these individuals as they transition out of homelessness or foster care into adulthood. Text message prepares them to make healthy decisions, increase violence suppression, thus reducing HIV transmission. This is one of our permanent supportive housing HUD funded programs, which means that we have the capability of taking both people living with HIV as well as those other individuals that meet the criteria for as being a young adult between the ages of 24 with 1 episode at least of documented homelessness. And towards the end, I will discuss the eligibility criteria of getting the appropriate documentation required to enter these programs. The next program is also a HUD funded program, which means we can take people living with HIV as well as other individuals. It's a Housing First permanent housing program for chronically homeless adults with permanent disabilities. The goal of first responders is to increase stability and self-sufficiency among those living in Houston. So the next program, A Friendly Haven, is what we call a hybrid program because it is an isolated facility meant solely for the people enrolled in a Friendly Haven program, but it's both funded by HUD, Permanent Supportive Housing, as well as HOPWA, Housing Opportunities for People with AIDS. So this program provides permanent supportive housing for homeless HIV positive families and offers comprehensive services targeting the entire family to increase stability, resilience, and self-sufficiency. One of our next programs, of course, is the Help House Apartments, and that is a HOPWA funded program. It's a unique one-bedroom apartment complex for singles and couples living with HIV by providing permanent supportive housing that empowers individuals to live independently. Our Burr Street program is a unique shared 2-bedroom community residence for unaccompanied low-income single women, including transgender women, to live while achieving a greater sense of self-determination, resilience, and self-sufficiency. So and another program, which is a pilot program that we don't have listed yet, is the Bridge Reentry Initiative. You may hear it referred to as BRI, which houses people living with HIV that are recently released from incarceration. And it hasn't been listed yet because we're going on our second, I believe, year, our second grant with that particular program. So the next sheet will give some more in-depth information on how to enroll in the program. And these documents, of course, have been sent to the host. So it can be shared to whoever's on this, attending this program. This particular sheet that's on the screen now is for service providers, whereas the first sheet was more aligned a list of and menu of services that we issue to clients. So can everyone see this screen? Let me see some reactions if you can. Let me know you're alive. All right. So the requirements for all the AFH programs is applicants must be able to perform ADL, activities of daily living, meaning that they have to be more or less ambulatory because some of the properties, most of the properties are off-site. Some of them are just within a regular complex, apartment complex, and can be upstairs and things of that nature. And there's not a common monitoring of these clients. Oh, I'm sorry, I'm reading the chat. Okay, so applicants must consent to an initial criminal background check. Now, while this may not cause you to be rejected from the program, it sometimes affects placement because a few of the programs are just a rental subsidy program, meaning that you locate your own unit within an apartment complex and we pay the rent for you. So therefore, it may delay your process, and we want to know how to properly refer you to properties and things of that nature. And all applicants, adult family members must consent to a urinalysis assessment. Note, a positive UA does not automatically disqualify persons from entry. So moving into the eligibility criteria, starting with Help House, the program that's for individual or couples, where one member must be living with HIV or AIDS because this is a HOPWA funded program. So the eligibility is that all applicants must be 18 years of age or older. And where it states couples, it can be any type of couple, same sex, opposite sex, just identifying as a couple. Income is not a requirement for entry. Documentation of homelessness is not required. Transgender person is eligible. Willing to increase income through employment that would suffice to sustain independent monthly living expenses. Our next program is Project A Friendly Haven. It says homeless families with children and at least one member living with HIV and AIDS. Now, the thing about Project A Friendly Haven is you determine what is a family. So anyone is eligible as long as they can prove custody of a child, a minor child. So applicants must have physical legal custody of one or more children under the age of 17. Income is not a requirement for entry. Families may include any adult heads of household. Appropriate families being referred to Haven. The total number of family members should not exceed 8. The definition of family includes extended family members, i.e. grandparents as head of household, adult sibling acting as head of household, etc. And willing to increase income through employment that will suffice to sustain independent monthly living expenses. Our Bird Street program is for single women living with HIV and AIDS, with the eligibility being all applicants must be 18 years of age or older. Income is not a requirement for entry. Social Security can be pending. Documentation of homelessness is not required. And transgender women are eligible. Now, this is the key part because this is the cause of many of our referrals declining the program. Individuals must be willing to live with a roommate. And what that looks like is not a sharing of a room. You would have your own individual room. It's just sharing the common areas, which is the kitchen, bathroom, living room. And must be willing to increase income through employment that would suffice to sustain independent monthly living expenses. First responders program, only chronically homeless and disabled unaccompanied individuals. Applicants must be chronically homeless, living on the streets in a shelter or place not meant for human habitation for at least 1 year, or at least 4 episodes of homelessness in the past 3 years that total at least 12 months. And this all has to be documented. So I will go into that in depth when I discuss the coordinated access process. Income is not a requirement for entry, and applicants must have a proven permanent disability. They must be willing to increase income through employment that would suffice to sustain independent monthly living expenses, and transgender person is eligible. This is First Responders is the program that I was stating is basically a rental subsidy. So a client must be lease ready and things of that nature. So if a client maybe enters without income, of course, they would have to locate a all bills paid unit to make sure that, you know, they keep their utilities and things of that nature. Project text message is for homeless unaccompanied young adults. So eligibility is all applicants must be 18 to 24 years of age. Income is not a requirement for entry. Documentation of homelessness required. And that can be 1 day, 1 night, it just has to be documented. And transgender person is eligible. Individuals must be willing to live with a roommate and willing to increase income through employment, volunteer, or interested in continuing education, i.e. college, GED, and vocational training. So and of course, see, it's not on the sheet, but there's the Bridge Reentry Initiative as well, which is for, I see Miss Kelly, who is the community health worker case manager for that program, is attending as well. But that program is for people living with HIV that have been recently released from incarceration. So how do we receive referrals for this program? We all use the Coalition for the Homeless coordinated access process, which means that each individual requesting housing through AIDS Foundation Houston, and technically any housing program within the Houston-Harris County area, must complete a housing assessment through a coordinated access housing assessor. So the good thing about it is that we have 2 here at AIDS Foundation Houston. And the thing is, they cater to, well, one of the 2 is capable of completing housing assessments for anyone, be they a person living with HIV or not. You can call, you answer a few questions, and then you are referred to a program either here at AIDS Foundation Houston or wherever you meet the criteria for that. So what I will do is place in the chat the contact information for those individuals here at AFH, where you can reach out should you have any questions, comments, concerns, or if you would like to refer somebody for a housing assessment, or you can give the information directly to the client and they can call in for that as well. A good thing about all of these programs as well is most of them come fully furnished. They have their own case management staff to provide wraparound services, far as transportation assistance, food assistance. We, of course, have the Stone Soup Pantry here as well as the Bridge Reentry Initiative, BRI, is also connected with what's called the MTAP program, Medical Transportation Assistance Program, which they provide transportation assistance via Metro, Uber Health, as well as some taxi vouchers and or gas vouchers to assist clients with getting linked into care, as well as adhering to their medication. That program also can assist with food assistance as well. I'm sorry, hold on, let me stop share. Any questions so far?
I know we might have questions. Charleston, if you can make me a host,
Okay.
I just want to make sure that if folks are in the waiting room, we can let them in so they can also ask you questions while you're here. But we'll open it up to questions from the group.
Okay, because I know I've been accused of speaking a bit fast, so I just want to make sure. Okay. So I think that was pretty much the extent of the Housing and Services Department here at, oh wait, no, excuse me. We do have a newer program as well, which is called the CARE program. It's pretty much a mirrored project like the Coalition for the Homeless Navigators. So should you complete a housing assessment, get referred to one of the programs, and they contact you regarding their eligibility that requires maybe documents that you do not have, you can be referred to the CARE program to assist you with navigating that. Such as, should you need an ID, they can provide the referral for Operation ID. So therefore, there will be a warm handoff between you, the person completing the assessment, and the referring housing program. I see a question also. Thanks for, these are all within Harris County. Are you speaking of are all the housing programs within Harris County? Yes, they are all within Houston, Harris County area. And the thing is, there are two different types of programs. One is clustered, meaning that all the clients are housed at one site. So the majority of our programs are clustered sites. And then there are scattered site programs as far as first responders. That's where the client chooses their own unit and are in their own lease. We are just paying a rental subsidy for them and providing them with case management to ensure that they remain stably housed and things of that nature, and just providing housing assessments as well as property inspections to make sure they're having an upkeep of the unit, especially with the chronically homeless population. Someone said, does anyone know if Operation ID is back open? Yes, we just recently renewed our MOU with them as of, I think, Friday, so they should be open. Good evening, are there any programs in Jefferson County? I'm not aware of any programs in Jefferson County. However, the assessors are supposed to be keeping a list of resources, as well as when we attend the HMIS forums and things of that nature, we can network and I'm sure provide some of those.
So Jefferson County is like the Beaumont, Port Arthur area.
Okay.
I wonder, so a couple of takeaways from you that's coming up for me, Charleston, is a lot of the services that you talked about, particularly around the housing programs that AIDS Foundation Houston has, are for people living with HIV. And so we know that housing is an issue for people in general, and it's a bigger issue if you are not living with HIV. There's a lot of support for people living with HIV, which is a great thing. But we know that housing stability is an issue for people who don't fit that eligibility criteria. So I think, we already knew that housing was going to be a challenging conversation in terms of like resources. Maybe what I'm thinking is, as we go along, if people have ideas or other resources across the state that they can share, I think that might be a good place to start. But Latasha, I see that you wrote that question. I want to ask if you were looking for resources for people living with HIV, because there are some HOPWA providers in Jefferson County, or not. I think that might help us direct you a little bit better. And you're still on mute if you're trying to talk.
And for that, what I would like to suggest is probably getting in contact with the Coalition for the Homeless and trying to register and attend what's called the Navigation Work Group meeting. They have that once a month, and that's where they monitor like all of your vacancies and things of that nature. But everyone that is a housing provider usually is a part of that meeting. So therefore, it'll be a good place to network. And then they even open the floor towards the end for you to receive some assistance, some troubleshooting, as well as connect if you're working maybe with the same client and things of that nature. So just probably try to reach out. Oh, I see your mouth moving, you're on mute. You're still on mute.
Okay.
Yeah.
Hi.
Hi.
I was in particular talking about HIV clients. Here in Port Arthur, I'm the Assistant Health Director for the City of Port Arthur. So I deal with a little bit of everything. I do work closely with Cordella Lyon, who is at Baptist Hospital. So I'm going to take your advice and see if I can become part of the meeting that you were talking about.
Yes,
So I appreciate that. Thank you so much.
you're welcome.
All right.
And Latasha, a quick question. Are you familiar? So I know that you say you're familiar with Cordella. Are you also familiar with Shatera?
I am.
Okay, so
I am.
I would, because she's the HIV planner, I know she would know better. That's the person I would reach out to. So she might have some resources, because I'm not sure if they've identified a HOPWA provider in Jefferson County yet or not. I don't know, but she would know.
Okay, and thank y'all so much for the information.
Not a problem. Thank you for your questions. And thank you, Jamie, for putting in a Southeast Texas specific group in the chat. It's QTPOC of Southeast Texas, and you can find this group on Facebook. So people are already gathering in community to like share resources. Thank you so much for that.
Right. And QTPOC, they're also providing holiday resources for trans TGNC folks. So if you're someone on the live right now and you are needing holiday resources, they are begging people to reach out to them to get the holiday resources that they have available.
Who was it?
It's going to be the QTPOC. It's inside of the chat. If you just click on that link, you can also find them on Facebook. On Instagram. Their executive director is Linky Love, and she's doing some holiday giveaways and things like that. Granted that she's in Beaumont, you do not have to be in that area to tap into the resources. She's looking to work with people in Houston as well. So if you're in need of that, please reach out.
Great, thanks.
And Charleston, I have a quick question.
Okay.
You said that in one of the housing that you would have to have a roommate. Could that be you and your partner, or is that someone that you all choose for that? Because you said they were shared, like the kitchen and the common area, they would have separate bedrooms, right?
Right. 2 of the 6 programs are roommate situations. So what we typically choose not to do with Project Text Message is if they are a couple and if the availability is there, we typically don't house them together because of, should something arise, it will involve probably shifting the dynamic and moving around and things of that nature.
Gotcha. Okay. Got it.
And
Thank you.
just a shameless plug. So three of the 6 programs are still accepting referrals at this time, and 3 of them are currently at capacity. The Help House program is at capacity. The VRI transitional portion of the program is at capacity, as well as first responders is at capacity. So Project Text Message, which is the young adult program, is still accepting referrals. And that's one of the programs that where you don't have to be a person living with HIV, as well as the Burr Street program is still accepting as well. And A Friendly Haven, which is the family program, is still accepting referrals at this time.
And all 3 of those programs accept people who of trans experience?
Of course, yes. You you have to meet the other requirements. So like with the family program, they have to have custody of a child. Those are not gender specific programs.
And the Burr Street was the one you had to have a roommate?
Right. Oh, I'm sorry. And I did misspeak. Burr Street is a gender specific program, but they do take trans female. And Project Text Message may have the option. It has both. We have some 1-bedrooms and we have 2-bedrooms, but we never speak of that because we don't want it guaranteed, and you can't just request a 1-bedroom. Okay. And are there any other questions? If not, I believe that's it for me.
Wonderful. Thank you so much, Charleston. We really appreciate you for being here. We're going to go right into our last presenter. We're going to have Jamie talk about resume building. And this is recorded, so this is great to share with folks after if they couldn't make it. And then we'll talk about a few more resources, especially navigating like the mental health system, finding a therapist if that's the direction you want to go in. And then we'll wrap it up. So thank y'all so much for hanging in there. And you have the floor, Jamie.
Thank you for having me. Anything that has Vernus's name tied to it, it's an honor to be a part of it. So I'm just glad to be here and share space with you today. We're going to be talking about resumes, particularly how you can make sure if you are applying for jobs, but you're not being able to make it to that interview round, what are some things about that resume that maybe you can change that can help you get into the door with that interview. So my name is Jamie Gonzalez. My pronouns are she, her, hers. I work at the University of Houston as a career counselor. So we're going to talk about kind of just resume tips, tricks, and things to consider. And then if we have time, if you have any particular specific questions, we'll have a Q&A. So as we go, if you have questions, I will try to keep up with the chat. But if I don't see them, jot them down and I'll make sure I'll get to them at some point. So, all right. So some questions that I hear all the time about resumes. What skills am I supposed to be putting on here? Do I need to include all of my jobs that I've ever had on my resume? How many pages should my resume be? Do I need an objective, a summary statement? Is that required? And how many bullet points should I have? So if these are questions that you have, we'll talk about some of these. I'm remembering that we actually have more time than I originally thought, so I'm going to slow down. But if there's any questions that you have about resumes, if you want to drop them into the chat, and if I wasn't going to address them, I'll try to address them as we go or address them at the end. So like I said, if you have questions either now or as we go, feel free to drop them in the chat. Unfortunately, the answer to most of these questions are it depends. So with your resume, some of the questions, it depends on what the industry is or what your experience was or what you're wanting to get out of it. So unfortunately, there's not usually one answer for all questions about resumes, but we'll talk about some general guidelines for today. That's hopefully helpful. So here are my 3 R's of resumes. You want to keep it as recent as possible. And ideally, recent kind of means within the last 5 years. The only thing, sorry, Crystal, the only thing I'm noticing is that I can't pull up that participant list, but hopefully if people pop in, I'll be able to see it. I just want to let you know.
Okay, no problem. And just a heads up, even if you have the participant box open, list up in the chat, we can't see it. We can only see your screen.
Okay. 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 But you can have, people have access to the chat if they want to write into the chat, right?
Yep.
Cool.
Yep.
All right.
Because
All right.
Sorry, Jamie, but because you're showing the screen, all of your features may be at the top instead of at the bottom now.
Features at the top. Ooh. Furnace, this is why you are all of the things. I appreciate you. You just helped me find it. All right, cool. All right, I feel like now if people show up, I can let them in. That's important. All right. So to answer the question, this kind of answers the question along the lines of like, should I list every job I've ever had on my resume? No, not necessarily. If it was a job that you had 20 years ago, 10 years ago, 7 years ago, and it's not directly relevant to the position that you're applying for, you can go ahead and leave it off. And so, but what you can do is that when you go to fill in that application will ask you, list out the jobs that you had and the general jobs and responsibilities and duties. And I know it's like every time I do it, I'm like, I'm giving you my resume. Why do I need to list this stuff out on my application again? But the idea is that your resume is really like your trailer, like your highlight reel. Here are some highlight features. And you can put all of your history in that application. So your resume doesn't need every single job. You just want to highlight kind of that most recent. In addition to the recent, you also want to highlight the most relevant. So these are experiences related to the role that you're applying for, the job description, that industry. And sometimes we have jobs that maybe it's not the exact same job, but there are skills that you were doing it. If you are, we'll have an example today about a cashier role at, where is it? Best Buy, and how that relates to if you were wanting to be a financial aid representative at a university. So that's our example today. And so even though people might see these things and be like, oh, this isn't exactly the same, there are going to be things that you're talking to people, you're problem solving, you're having customer service, you're working in a team. There are things that are transferable that you can highlight for the job that you're applying for. And then think about your resume as real estate. And so how long should how many pages should my resume be? If you have less than 5 years experience working, I would say 1 to 1.5 pages. If you have more than 5, you could go to 2, especially if especially if you have really relevant experience. You don't really want to go more than that. So sometimes if you're listing every single job that you have, it might be 3 or 4 pages. A hiring manager might only spend 15 to 20 seconds skimming your resume. So you want to make sure that when they are like kind of skimming through your resume, that all these keywords and these things that they're going to think are relevant to their job are popping out, and that because in 15 to 20 seconds, they're going to have to make a decision. Are they moving on to the next resume, or are they going to put you in the like, let me look at this a little longer, let me consider this person for an interview? So that's how quick it takes, and that's how important your resume is. It needs to make a 15 to 20 second impression on a person. All right. And then also thinking about if that's the case, we read top to bottom. So that the top things on your resume should be the most relevant to that position. And so if that is I'm trying to think if that's whether that is like if you got a degree or whether you had a job or if you have volunteer experience, you can rework your resume to make sure that that most relevant thing is showing up at the top. And we'll talk a little bit about what that can look like. So in your resume, your meat and potatoes are those bullet points under that work experience. And so under those bullet points, if you are just listing out general responsibilities and duties that anybody lists on a job description, that's not helping you stand out. So you really want to think about your bullet points on a resume as being your points of pride and those accomplishments, and what are the things that you did in that job that you did really well. And I have some examples of them too, so we can look at like what that looks like in format. But bullet points, mostly you want them to be in this format: a verb plus the task that you were asked to do plus what was the result of that. An example of what this looks like is, so say you collaborated with a team of 5. So I used to wait tables, and so I would usually have about 5 or 6 other staff members with me during any shift. So that could be a team of 5. Is who are those people on your team working with you at any given time? Collaborated with a team of 5 to answer questions and resolve issues. So say you work at a call center, and then people have the option to leave surveys or ratings for you. If you know what your rating is and it's pretty good and it's something like you have a 85% customer service satisfaction, that's something that you can put on your resume, and it's something that like makes people go. You're not just saying, oh, I did this well. You're saying like, I have a number of information that I can give to you to prove that I did that well. Did you say, oh, okay, sorry, I'm just reading a note. All right, so quantifying bullet points. So how can you add numbers to your bullet points to make them even stronger? One, you can list a range. So say that you see customers every day or clients. You can say that you assisted 50 to 75. Say you don't, this number changes every day. It could be a range, whether it's a slow day or like a peak season where you're seeing a lot of people. You can add a range in there. So I've assisted 50 to 75 customers. You handled, say you're working a cashier, you're handling $2,000 to $4,000. Could be a range that you list. And then you can talk about like how frequently you do something. So if you are attending trainings weekly, or you are meeting goals monthly, if you have some kind of frequency in which you are doing something, especially accomplishing something, that could be a way that you add that to a bullet point. And a scale. So if you had done something that improved a process, you made something work better, you saved money, or you reduced time it took to load and stock processes at your place of employment. If you wanted to talk about how you reduce something by 10% or you increase something by 10%, and also that doesn't have to be an exact number. You can do like an average or estimate. The Muse, you can look that up. It's a awesome website. I think they have some templates for resumes as well, but they just have some like great advice on general information about resumes and bullet points. Since we only have 35 minutes today, I would use that as continue information to get some resume related information. One of the most, I would say, important things to do with a resume is tailoring it to that job or to that industry. So if you have one resume and you are using that same resume to apply to all jobs, no matter what industry it is, no matter what job it is, you're probably not setting yourself up for success. So it does take a little bit of work. So pick jobs that you are really excited about and want to spend time on. And you'll want to do a little bit of research. And so looking at that job description, looking at that website of that company, looking for like key terms, and then actually thinking about, okay, what of these do I have or have transferable skills? And then how can I rewrite my resume? Not the whole resume, just some key words to make sure that I can pop up. Oh, thank you, Vernus. Vernus popped in the muse into the chat if you want to check it out. So, and rewriting your resume, or at least keywords of it. And so if you haven't heard, there's things called application tracking systems. And these are systems that scan your resume and read it. And they are looking for keywords, and it'll give you a score based on how many words in your resume match to what they're looking for that job. And you can usually use the job description to give you a good indication. And we're going to do a demo together to kind of show you what that process looks like. So application tracking systems, if you're not customizing and tailoring your resume, that system might be, especially for like employers like Target or like any big company that is might have 200 people who are applying to a job. They're probably using a system to look at your resume before a human ever does. So if you're taking that time to change out those keywords and helping it align to the job, that's going to give you a higher chance of getting to the interview round. So we're going to review a job description together, and then we're going to identify some of those keywords and then talk about how that can show up in an actual resume. So this is a financial aid customer service representative. This is the job description that was pulled. So what I will literally do when I apply for jobs is I will like either print it out, or I'll get a notepad or some paper, and I will like look through the resume and I'll just jot down keywords. And so we're going to go through this together, and I'm just going to show you what I would highlight for this job. So for this customer service representative position, say that you did have experience with customer service, but not specifically financial aid. This is how we'll be thinking about this. So in my jobs as a customer service industry before, I have probably assisted people. So I'm highlighting assist. Maybe I didn't work specifically with parents and students, but I worked with people with all ages. So I'll keep that in mind. I definitely helped with processes, and I answered a lot of questions and concerns and various communication methods. That just means whether you talk to them in person, you answer the phone, email, various communication methods. And then, so you wanted to ensure people felt welcome. So yeah, I make sure that people feel welcome, whatever job I work in. You're making sure people are treated with a level of respect, professionalism, integrity. Again, questions and inquiries are responded to, so that answering questions seems to be a theme here, in a prompt and timely manner. So I'm like, okay, so they think they care about, you needed to respond people quickly. And they have this word collaboration with other departments or different areas. Again, assist showed up again. So I'm like bolding that word because that's a word that came up more than once. So that's probably in an application tracking system going to be rated as like a high value word. Unusual situations and resolve issues so they can be successful. Assist colleagues, including customer service representatives, by answering their questions and providing information. So I bolded questions because that word showed up 3 times. So I definitely, if I've ever answered a question a day in my life at any job that I've ever had, I want to make sure that that language is showing up in my resume. This is the qualifications section. So you'll usually see like the education, experience, knowledge, skills, and abilities. So we'll go through this section too. So under education, if you have a high school diploma or GED, then here you would have it listed, but I probably wouldn't necessarily list it like at the top. If you have an associate's degree and if you have anything on a resume and they have that's preferred and it's something that you have, you definitely want to make sure that's showing up because that'll give you an edge to other people who are applying. Let me look and make sure. All right, I was letting somebody in. All right. So some experience. So a minimum of 2 years of professional work experience. So if you've worked any job for 2 years, this says directly in student affairs, student financial aid office, I would still apply for this job. If you've ever worked in a job that has dealt with answering questions, working with people between the ages of like 17 to 35, if you've had any experience working like a cashier, I would still go ahead and apply for this. But you want to be highlighting that like professional work experience and those transferable skills. So they mentioned like working with security sensitive and confidential documents. So if you've ever done anything like with payroll, if you've ever had to like handle like anybody's license or checking personal information, that could be counted as like sensitive information. Prior employment with a great deal of customer contact. So if you've ever had a customer service job, I would recommend applying for this job. Answering questions by phone or mail. So that's showing up again. Interpersonal, oral, and written skills. So again, they just want to make sure that you can communicate with people, that you have a high attention to detail, work under pressure, independently, handle multitasks, set priorities, meet deadlines. And then having an experience with Microsoft Windows, Word, Excel, Access. So the fact that they specifically mentioned Microsoft on here and like listed out the things, I would say if you've typed things in Word before, if you've ever done anything in PowerPoint, and even if you didn't, if you have access to it, I know Google Drive has like a free access version of these, and I would go around and play with them, because if you can do it in Google, you can do it in Microsoft. So I would say that you could like list that as something, just find a way to try to get that experience, if you or something very similar to it, and then play around with it, and see if there's any like free trainings that exist, or watch videos online on YouTube about like how to do different things in PowerPoint, and then practice them in that Google Drive, and so you can get some experience. So how do you take this and then actually tailor it to your resume? So say that you were a cashier at Home Depot. This may not seem exactly relevant, but this is how you would kind of like change it to show them those key things that we had already highlighted. So you supported the in-store customer help desk. So obviously you were answering questions to provide respectful and professional answers, because that was language that they used. To answer frequently asked and unusual questions in person and by phone, including peak holiday hours. So I included that part because they had mentioned that timeline, a fast-paced environment. So that shows that you had experience in that. So they had the word collaborated, so we use collaborated. So with 25 team members to answer customer inquiries and resolve customer complaints. Completed over 30 hours of training on conflict resolution and improved customer service techniques. So if you work for anywhere that has ever made you sit through a training or a professional development, something or the other, count like you were being trained. That is education. Like use that to say that you are continuing to have a skill in something. So assisted and welcomed over 75 customers daily, and managed open and closing duties, including but not limited to handling cash, cleaning up, helping out with the workspace, and then that security component. So they had talked about security documents. Let's see how we're doing on time. And then this is for a dance studio. And so if you managed a studio or had worked a front desk at a studio, you could have an average of like how many phone calls did you answer a day? Who were you talking to? Were you resolving issues at the front desk? This person happened to handle payroll for staff members. And so that is security sensitive and confidential documentation. So this is where somebody might not see these examples or these job descriptions as being directly relevant to financial aid. This person has found a way to make those connections between the two positions. Okay, so before I get into objective and summary statement, we talked a lot about bullet points and tailoring, but does anybody have any questions so far? I don't see necessarily in the chat, but if anybody wants to ask a question at this point, specifically about bullet points or how you would tailor, feel free to ask. All right, we'll keep going. So that objective and summary statement that shows up sometimes on templates at the top, it's like, is that something that you really need? I say it's optional, but use it wisely. So if it looks something like I'm a highly motivated and customer service oriented professional seeking a full-time opportunity to grow my skills and experience at a university, using our example from before, I say get rid of it. You didn't tell me anything unique. You didn't tell me anything specific. So this is the first thing that they're going to be reading. Most people who are applying for this job are probably going to be relatively motivated people and may have customer service. So you need to make sure that you are standing out if you are going to be wasting space by having a summary statement. So this would be an example of if somebody had 5 years of professional experience in customer service industry, assisting 100 customers per day in person and via virtual help desk. So virtual world is important now. And trained in conflict resolution and cash handling. So maybe this person picked out specific things that they had said that they had preferred or had highlighted on that resume and added it to their summary statement. But know that no, it is not a statement at the top of your resume is not required. But if you are going to use it, try to be really specific with what are the things that you think they're really looking for in this job and how can you highlight those things if you have them. Legal versus preferred name and pronouns on your resume. So we'll use my name, for example. So my name is Jamie Danae Gonzalez. And so say that Jamie is my legal name, but Danae is my preferred name. Here are some options that you could use on your resume. So if I only use my preferred name, it might, if they're showing up in the application a certain way, because you'll have to use your legal name at some point. Then, and if you're scared that they won't be able to match them up, you could put like a first initial, but then highlighting your preferred name. So then that way the first name that they see is Danae on the thing. If you feel comfortable, if you think it's a super inclusive space and that they'll understand or know what pronouns are, you can put your pronouns at the top of the resume. If you're scared that they're going to ask you questions or they're not going to understand, you can choose to leave them off. So ultimately, that's up to you and how comfortable you feel. If you want to abbreviate your first and like middle initial as well, and then if they ask you once you arrive about, what name you go by, you could approach it that way. You could just list your preferred name. So that is allowed on your resume to just have your preferred name. And so then that way, when they pull that document up, and then even if they have the legal name in the system, hopefully they'll take that as a cue as that is the name that you go by. If say that your first name, your legal name is not a name that you have a negative connotation with, it just is, but you have a preferred name, but you don't mind it being on your document, you could list it out and then list your preferred name either within parentheses or like the quotation marks, and that will indicate to an employer that that is the name that you go by. You'll see that like on an election ballot or, different spaces where people will like indicate like this is the name that I go by. So those are some suggestions if you had any questions about like legal versus preferred on your resume. So since your resume is not a legal document, you can absolutely include the name that you go by there. So hopefully that was helpful. So feel free, again, if you have any questions, I am happy to stick around. I'm happy to share. Here's my email address. So if the gonzalez.jamied@gmail.com. So if you want to email me, if you were here today, I'm happy to have a conversation with you specifically. So all the examples I used today were from a real person that we had worked through. So if that is something that you were interested as, because I love Vernis and Crystal is so awesome. That is something that I want to offer you. So feel free to reach out to me. I have an Instagram that like I mostly just share like career related stuff on. And also if you let me know if you're interested in a certain industry, I'm happy to like keep an eye out for like something that if something pops up, I can send it over to you and be like, hey, I saw this, because I see a lot of jobs because of the job that I work in and helping get students connected. So yeah, let me see, my chat went away. Bernice, I am happy to make you a Bitmoji. So you can have one.
Wonderful.
Cool. Yeah, I hope that was helpful. I know I kind of flew by it, but I knew it was a lot of information, and luckily there's a recording, so if you're kind of tapped out, you can always go back and watch it later.
Thank you so much for being here. We really appreciate you. And so I'm going to just move us right into our final presenter, and then we'll wrap it up. So we have about 20 more minutes. I want to give Shadon McCants. She is a licensed professional counselor, and she's here with us. So we are happy to have her. She's going to tell us about how to find a therapist, like navigating that part of your journey. And we'll also share some key resources that you can take from here and use for yourself. So Shadon, you have the floor.
Hello, everybody. So thank you, Crystal. Thank you, Bernice, and the Mahogany Project for having me today. I am excited to be with you guys. And like Crystal said, I won't stay with you guys long. My hope is to drop some knowledge nuggets on you guys regarding mental health and what that looks like. So as she stated, my name is Shadon McCants. I am a licensed professional counselor here in the Houston, Texas area. I have been licensed since 2013. And it is something that I truly, truly enjoy. I tell individuals I've been a therapist though since I was a little girl, giving advice and encouragement and teaching people just how to navigate this world in which we live in. And so I am just here to kind of talk about what does that look like. And so as a licensed professional counselor, you will hear, you often hear people say, well, when or how or why should I go see a therapist? And one of the things that I always try to encourage people to know is that mental health is important. Just like I would hope that everybody understands just how much our physical health is important to us, so is our mental health. And one of the things that I always encourage individuals to do, excuse me, guys, that just went down the wrong way. One of the things that I always encourage people to do is their annual monthly or their annual mental health checks. And so when I talk about that, I call it a heartbeat check. Because one of the things that I encourage individuals to do is always optimize their mental health. Optimization of your mental health goes in a lot of different areas, and you definitely, we can get sidetracked because we live in such a busy world that oftentimes we just like, okay, go, 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 and we don't take the time to stop. So my hope is that as we are taking care of our total mind, body, and soul, that we are remembering to stop and take care of, because a part of that is our mental health. And so what does that look like when we say mind, body, and soul? Because they are so very connected. So, when you're going in for your annual checks, the hope is now that most of our medical providers are making sure that they're giving you your screening for depression, your screening for intimate partner violence. They're giving you a screening for anxiety, just so that they kind of can know, is this something that's baseline or is this something that requires maybe some additional help? And so when I talk about optimizing your mental health, so I'm very interactive, and I see that I see a bunch of faces. So I'm just going to ask, is anybody currently, in therapy, or has anyone ever considered therapy? Okay, yes, I am a definite, okay. So I see Bernice said yes. And so guess who else is gonna raise their hand? Me. I am a therapist, and I tell people I'm a therapist with a therapist. And so I'm not gonna come to you and tell you anything that I have not experienced or am opposed to or not willing to do myself. And so this is something that I have a client. Okay. Great, Catherine. I will see you later. And so, you know, I encourage everyone to do what I call is your annual heartbeat check. Your annual heartbeat check requires that just as you're hopefully getting your OBG, your well women's, your prostate, you know, all the different things, our heart, our physicals, all those things checked, is that also you are checking in with the therapist. You're checking in with the mental health therapist and asking those important questions as far as, you know, am I setting goals? Am I doing the things that I have set out to do? Am I walking in my purpose? Am I walking in my vision? Am I connecting mind, body, and soul? And so it's just annually, as I encourage everybody just once to call a therapist and say, okay, am I doing this right? And one of the things is the next question is sometimes people are like, okay, well, what does that look like? How do I find a therapist? And so for me, I tell people my truth is that I've been in and out of therapy since I was 11 years old. I experienced trauma at a very young age. And so I've had a bunch of Tinder experiences since before Tinder was around. I had that, do you swipe left or do you swipe right? Finding a therapist is just like that. It's just like dating, because therapy is a relationship. And I tell people that, and people say, huh? Yes, you want to make sure that the therapist that you choose is someone that you enjoy. And when I say enjoy, is because this is a person, the therapeutic relationship and experience should be something that is safe. It is an environment that is to be non-judgmental, meaning that you should be able to come in here and literally offload on this individual and realize that they are there to support you along your journey wherever you are. Sometimes we come to therapy in a crisis. Sometimes we come to therapy just because, again, I'm at a space where, you know what, I just want to make sure that I'm doing what I need to do. And sometimes we're coming to therapy for a tune-up. That does happen. And when I say a tune-up, because that's what I'm back in therapy for right now, it's for a tune-up. You know, I've been doing this work on and off, like I said, for actually now 31 years. And so we oftentimes, I don't always have to be in therapy, but now I'm in a place where I feel like it's time for a tune-up. And so I'm back in therapy. And so it took me not to want to go back to my old therapist, who was phenomenal, but it was time for me to find someone new. And so some of the things that when you are optimizing your therapeutic process or you're considering finding a therapist, some of the things that I want you to make sure that you understand is that this individual is somebody who understands you. So you would want, for me, I prefer, surprisingly, I do very well with male therapists. Most recently, my therapist has been white male therapist that I do very, very well with. And so I've been able to find that out. And again, that was through my Tinder, I call it the Tinder experience with therapy. And that was because I've had experiences with Black therapists, Black females, Black males. But for me, I found that for me, what works well is a white male therapist. Love them, enjoy them. And I just recently acquired another one. And so for me, you say, well, how do you go about finding a therapist? Well, one, if you have insurance, your insurance company has a listserv of a list of all therapists. They break them down by race, by gender, by area of what side of town they live in, and by specialty. So for me, I definitely wanted a therapist that was comfortable working with African-American women. I also wanted a therapist that was holistic, that had a more holistic approach, and so was non-conforming to some of the modalities that I was taught and trained in. And so for me, that's what I looked for. So if you have insurance, that's a surefire way to find a therapist. Another way to find a therapist is also on what's called psychologytoday.com. And if somebody, Crystal, I know you're here. If you can write that in the chat, it's www.psychologytoday.com. You can go there. Psychologytoday.com is what I love about it, is because with or without insurance, it allows you an opportunity to find a therapist that will be suitable for you. So again, you can break it down by race, by gender, by specialty. You can break it down by area, by zip code. It allows you to find the therapist that you want, that meets the need that you want. Another good thing that I love about psychologytoday.com, or even when you call your insurance company, is that most therapists should, and I say should, offer a 10 to 15 minute consultation. And so that also gives you an opportunity. It's just like dating again. If I don't like what you said in the first couple minutes of the conversation, I'm done with you. That's another reason why I love psychologytoday.com, because if I go on there and I don't like your picture, what is it, swipe left, y'all? you're out of here. Swipe right, I might go ahead, if they have a good picture and it sends something to my spirit, then guess what? I'm more engaged to say something to you. So that's two options there. And so another option, guys, is something else that, okay, great. Another thing that I enjoy is there are other websites that I will give you, and I will actually make sure that Bernice has that. Love that question, Bernice. What are some questions? I believe you asked me, what are some key questions to ask in your first session? And so honestly, some key questions to even ask in the consultation. One of the biggest questions is depending on what you're coming to therapy for, asking your therapist, this is just me though, guys. The first question I feel is important is what is their self-care practice? Do they have a therapist? And I know that may sound intrusive, but that is a true question that you can ask them. Asking them, what are they comfortable with? Are they comfortable with, again, I'm a highly sexual person, I'm living with HIV, and I'm no longer identify as necessarily Christian, but as a spiritual individual. Well, what is their spiritual practice? Those are things because those things make an impact on your therapeutic relationship. Even though as a therapist, we are always supposed to be unbiased and non-judgmental, we need to, it's important that we know our biases and, what that looks like. And so, those are some questions that you ask. What is my spiritual practice? So for me, my spiritual practice is just that spirituality. It's that I believe in a higher power, and that is God, and that I am a source of divine. And therefore, I do still believe in Jesus Christ. Yes, I do. But there are some other streams or other avenues that I have chosen to go down. I'm not a religious person at all. I believe that spirituality is truly about your connection with the higher power, that being universe and God. And so that's kind of where I am. And so when I'm open to any religion that comes in, religion and or spirituality that comes into my space. That's just me, that's who I am, but everybody's not comfortable and everybody's not accepting and willing to that. So those are questions, some just basic questions that you might want to ask your therapist when you're trying to look for a therapist, because those things matter. Again, as we know, we're in the where this is a whole trans empowerment resource. So you want to make sure that that individual is also okay with working with an individual of trans experience. You don't want someone that is not familiar or understanding of your experience or your plight. You want someone who is being able to be non-judgmental and open to where you are in your journey. And if they're not, be willing to tell you that and give you the referrals that are necessary to help you along your journey. You also want another question is what is their experience with trauma? Do they have any experience with trauma? We often know that a lot of us have experienced trauma. So you want to ask the individual too, what is their experience with trauma? We know that our lives are filled with trauma, especially if you're amongst a marginalized community. That is definitely something that you want to make sure that this individual is aware of and understands how to deal with that. My experience with trauma is actually very intense. I'm actually considered a trauma-focused therapist. I'm studying a new modality as we speak to make sure that I continue to offer a wide scope of treatment for individuals who have experienced trauma beyond just PTSD. Even though PTSD is way more common than individuals would like to diagnose, I am a therapist that focuses a lot in dealing with trauma and the parts of us that have been hurt, that have been broken, and that definitely need our attention and our healing at this time and space in our life. And so just wanting to make sure that, you are finding and seeking out what it is that you need, so that when you start among this journey, that you find an individual that's just, some people, again, now I will say this, some therapists and some individuals are okay with going into a therapeutic situation or relationship, and it's like, I'm here, I just need a quick fix. However, there are also, you want to know if this is something that you need a quick fix, or is this something that you are ready to go along the healing journey. And that's another big difference in the therapy that I provide. I have learn to understand that I am not a quick fix therapist. I'm a therapist that when you are ready to do the healing work, that's the therapist that I am. And so there are those types of therapists as well. There are the therapists that are going to give you some homework, some assignments, and then you can just go about your day. But then there are some also therapists I've been coined to kind of be a Yala Van Zandt, even though she's a coach. That is the type of therapy that I do. I am a therapist that believes in the healing journey. In order for us to authentically be who we are and live in our purpose, we must heal. And so that's another thing that you want to think about when you are seeking therapy. And let me ask, I'm just looking at the questions, guys, at the same time. Yes, definitely. So the question was proposed to me, are you able? So yes, again, guys, this is what I want you guys to understand. Therapy is your journey. It is yours. So you should be able to be comfortable to ask your therapist and talk to your therapist about anything that is coming up for you. If he or she is uncomfortable, then yes, it is maybe time to consider a new therapist or not even starting with that therapist. So right now we are in a racially charged climate. It's something we can't get around. So definitely asking the question and the comfortability of the therapist when it comes to dealing with racial and social issues that in the climate that we're in. So yes, if you feel comfortable or feel the need to ask your client about white privilege, white fragility, if you want to ask about what is their stance on white supremacy, what are their thoughts about, again, the trans experience, what are their thoughts about LGBT community, what is their thoughts on equality? Yes, that 15 minutes, that 10 to 15 minute consultation is for you to really get to know. It's like speed dating. It's the first 10, 15 minutes are very important, and you get those questions out that you need to ask them so that you can make sure that as you embark upon this journey, one, you feel comfortable, you feel safe, and you feel non-judged to be able to, go on that journey of healing with that individual. Because honestly, when you start therapy, I tell people, if you're in a great relationship or this is something that you're really ready for, you will be in therapy depending on what issue you're bringing forth. You may start with one thing and it may evolve to something else. Most of my clients that I have had over the years have maintained a therapeutic relationship a minimum of 6 months, most of the time max 18 months to 2 years. And that's because we do a lot of great work. And so that's another thing that I want you to think about when you are thinking about your therapeutic relationship. Another question, am I okay with working with folks living with HIV?
No, I was just saying in general, like you want to ask that question as well.
Oh, okay, yes, definitely. And that's another thing. And so I was gonna just answer the question because it's very real for me. As a licensed professional counselor, I didn't put that part out there, but I'm also a woman living with HIV for 25 years. And so definitely, of course, someone asked me that question, I'm like, yes. But you also want to ask individuals that, are they okay with not just someone that's living with HIV, but another thing is, what if your life is as a sex worker? You want to make sure that that person is non-judgmental and they're okay with working with individuals that are of other life paths. You want to know that. You want to know if this person is okay with that. And so those are things that you want to look at as well. Interfaith community. Okay, yes, thank you guys, because I was actually going to give you those resources. Another one that you want to add is for individuals that do not have insurance is the Harris Center for Mental Health and IDD. They also offer services to individuals, therapy. It's based off your income. And so again, that's the Harris Center for Mental Health and IDD. I was gonna also put Montrose Center. You already hit therapy for blackgirls.com. You also, there is Black Therapist Rock. .com. There is melanin and mental health.com where you can also go and find a therapist. So yes, guys, know that there is nothing wrong with asking for help. There is nothing wrong with seeking help. There's nothing wrong with therapy. Actually, just like I said, if you are okay with, and I hope you are, with making sure that that your physical health is okay, your mind, body, and soul are connected. Therefore, therapy is just as essential. There is nothing wrong with, there is okay to not be okay. So that is where I'm going to stop with you guys right now. If you have any other questions, definitely Bernice knows how you guys can reach out and find my information. But everything you can find me is at Shadon McCants on Facebook, Instagram, Twitter, all of those. You can DM me or send me a message. As I stated, I am a therapist with Know and Live Counseling and Consulting. So if you have any questions, feel free to reach out and I'll do my best to help navigate you through this journey.
Thank you so much. I really appreciate you being here with us. And, you know, we are right at closing. So thank y'all for being with us today. And congratulations to everybody who stayed with us the whole time. The idea behind this is to not hoard the resources, but share it with somebody else. So when we send out the link, share it with somebody else. When you go home or go back to your community, share these resources with someone else. Thank y'all so much for being with us today, and have a great and safe evening. Take care, y'all.
Bye.